The Surgeon General of the U.S. is going to be here in Austin today talking about an issue that's important to every parent, which is their child's health. And joining me this morning to talk about today's event, Dr. Deanna Hilscher. She's the director of the Michael and Susan Dell Center for Healthy Living. She also works at the Austin campus of UT's Health School of Public Health. Good morning. Thanks for being with us. I appreciate it. Sorry for that. So the Surgeon General coming. This is a big deal. I mean, you know, he's a very important person in this. What specifically, though, are the issues that are going to be covered today?
He's going to be talking today about resilient communities and raising healthy children. Mm-hmm. The goal of the center is prevention, health prevention, and we focus on childhood obesity. Mm-hmm. One of his recent initiatives has been a call to action called Step It Up, and it's increasing walking and promoting walkable communities. And that's very much in line with what we do. So we're very excited to hear his vision for Americans' health and how we can help build better communities here.
You mentioned the childhood obesity. I mean, we hear so much about it. It is such a big issue. We have seen school-based programs in place now. Are they working, or how well are they working?
Actually, school-based programs work very well. We have a program that we've worked with a lot within our center called the Coordinated Approach to Child Health, or CATCH, and we have several studies that show the efficacy of that program in preventing child obesity. One of the biggest issues, though, is most schools don't implement correctly, and we find that that's the problem. It's not the program's fault, but it's rather it can't be implemented because of focus on testing and lack of time and other things that take a priority in the school setting.
And they're all real-world factors, though, that need to be dealt with.
Yes, they are. Yeah.
Interestingly, the city of San Francisco this week started putting together a plan to raise the smoking age to 21, which is kind of, I think, interesting because I think a lot of us feel like smoking may be something of the past, that young people don't do as much as, but is that the case? Is it still an issue with young people?
Smoking and tobacco use is still an issue with young people. It's really a problem because tobacco is the single most preventable cause of death in the United States. And what happens is 9 out of 10 kids who try tobacco products before the age of 18 end up smoking into adulthood. And so they become hooked because of the nicotine in the cigarettes.
But are we at least seeing some improvement, that it's not the way it was maybe, you know, when we were younger, kids starting smoking, maybe, like, it's not maybe as cool as it used to be?
There is some improvement, but you can any amount of smoking among kids is still something that should be avoided. And we have several projects at our center that are actually focused on tobacco prevention. Improvement,
but still work to be done on
Correct.
The issue. That's very good. Well, the event begins today, 2 o'clock, in the Edgar A. Smith building. That's on the Blant Museum there on East MLK. We have a link for you to register at kxan.com. Dr. Deanna Hilscher, thank you so much. We appreciate it.
Thank you, John.
All right, time now is 8:21. We'll be right back.